How accurate is a DRE compared to a PSA test? When it comes to prostate cancer detection, many people wonder how accurate the digital rectal examination, or DRE, is compared to the prostate-specific antigen, or PSA test. Let's break it down. The DRE has an overall diagnostic accuracy of about 63%. This means that it correctly identifies prostate cancer in about 60% of cases where cancer is present. It also correctly excludes cancer in about 67% of cases without it. However, the positive predictive value of a DRE alone is approximately 52%. This indicates that just over half of positive findings from a DRE correspond to actual cancer when a biopsy is performed. On the other hand, the PSA blood test has a positive predictive value of about 45% when using a cutoff of 4 nanograms per milliliter. While this is somewhat lower than the DRE alone, the PSA test is more sensitive in detecting prostate cancer, especially when combined with other diagnostic tools. When both the DRE and PSA tests are used together, the detection accuracy improves significantly, with the positive predictive value increasing to nearly 68%. This combined approach helps identify more cancers than either test alone. However, there are limitations to consider. The DRE only allows the examiner to feel the back part of the prostate, which means it may miss tumors located in the middle or front. It is more likely to detect cancers in the peripheral zone of the prostate and is associated with higher-grade tumors. Meanwhile, PSA levels can be influenced by benign conditions like prostatitis or benign prostatic hyperplasia, which can raise PSA levels without indicating cancer. Current clinical guidelines increasingly favor multiparametric magnetic resonance imaging after elevated PSA or suspicious findings. This imaging method has higher accuracy and can reduce unnecessary biopsies. It is important to note that neither the DRE nor the PSA test is perfectly accurate on its own. The PSA test is generally more sensitive but less specific than the DRE. Using both tests together improves diagnostic accuracy and helps guide decisions about prostate biopsy. In practical terms, the DRE remains a useful clinical tool, especially when PSA levels are normal but suspicion remains. However, its role as a standalone screening test is limited. Advances in imaging and biomarker tests are changing how we detect prostate cancer, but the PSA and DRE tests continue to be important initial assessments. In summary, while the DRE is less sensitive but somewhat more specific than the PSA test, combining both improves detection accuracy. Neither test alone is sufficient to definitively diagnose or exclude prostate cancer, and further evaluation with imaging and biopsy is often required. Always consult with a healthcare professional for personalized medical advice.